Hi, I'm Jason Bellamy, coming to you from the Federal Advocacy Forum in Washington, D.C., and I'm joined by Sandra Norby. Sandy, first of all, how many Federal Advocacy Forums have you been to, and what does this event mean to you?
This is my 8th event, and I tell you what, having been involved in advocacy, I know that our voice does make a difference, and it's all about helping our patients and preparing our profession to be around for many, many years. And it really takes a lot of work, and Congress makes a lot of decisions, and so it's important for us to be here.
So many people like you keep coming back, but for somebody who's never been through an event like this, kind of walk me through it. Give me the short version of what does Federal Advocacy Forum entail?
Okay, well, first I have to say that I was invited by one of my mentors 8 years ago, and so I think that's one of the best things that we can do is invite other people. And there's like 80 students here this time, which is really awesome. We meet. I really like how the speakers they pull in speakers that are analysts or people that are really wise here in the Washington D.C. area, and so we get to learn firsthand about the issues and about policies and all that kind of stuff that kind of jazzes me now as I get older in my profession.
So you get fired up about that, then obviously eventually you go to the Hill and you actually have Hill meetings. But that's what's happening here at the federal level, but so much happens on the state level in between those things. Tell me about some of the Locum Tenens advocacy that's been going on in Iowa in the past couple of years.
You bet. Well, I'm the professed poster child of Locum Tenens. About 4 years ago, I covered a maternity leave for one of our partners. And because we were not able to have the ability to do Locum Tenens, I was duly provider enrolled in that clinic, and when Asher was born, I took my blow-up bed and spent 12 weeks sleeping in one of the treatment rooms to be able to make sure that those Medicare patients did not have a break in their care. A little town of 500 in Buffalo Center, Iowa, and so I brought that compelling story to APTA, and through the help of Senators Grassley and Harkin at the original time, got the Senate side bill going, and some great support on the representative side, and through a couple trials that the bill became a law, and that's pretty cool.
So when it ends, it always sounds like, well, that was pretty easy, but it never is.
No.
So for somebody who's trying to get something accomplished in the advocacy level, how many trials were there? How many stops and starts?
Yeah, it was really interesting because I had my story, but they really wanted to make sure it was true, that I had actually called a traveling PT company and was not able to know who that therapist was enough in advance to get them provider enrolled. So there was just a very interesting background information. I was able to testify in front of one of the House committees, and the preparation that APTA and PPS staff did to prepare me for that was just phenomenal, and it was a great experience. In that Senate or in that House hearing, every one of the representatives that spoke had a personal story from a physical therapist in their district that they shared as well, and so through that grassroots effort, it just was a great experience, and it worked.
So for somebody who's thinking about, listens to that story and thinks I want to make a difference like that and wants to get involved, what's your advice either for how to get started or what makes a really effective advocate? What advice would you give to somebody who wants to make that same kind of impact?
Well, be aligned with your association, because Locum Tenens was one of our policy platforms. But you really start at the state level. I know Senator Grassley's local state director in our area and have met with them several times. I attend town hall meetings when our legislators are back in Iowa. And then every opportunity to get out here and speak on behalf of our profession is the end goal.
So it's location, location, location in real estate, and it's relationships, 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 and advocacy. She's Sandra Norby. I'm Jason Bellamy, and I'll catch you later.